Within this presentation, I will discuss the anatomy, injuries that can occur, diagnosis, and prevention of Achilles tendon injuries within equine athletes. A quick overview of the anatomy and the horse's leg. Throughout evolution, the horse's leg has gone from 3 bone structures to provide support down to only 1. The 2 bones that were on the outside slowly shrank in comparison and became what we know as splints. With the bone that continued to hold the support, there is a piece that is known as a coffin bone. This bone is so small, with the amount of weight that's bestowed upon it, it can easily be corrupted from its original position. And because of this, the coffin bone can gradually start to push through the sole of the hoof and cause a great deal of pain to your horse. So there is the Achilles tendon, a thick fibrous tissue that is made up of multiple tendons. These tendons run down the backside of the leg while connecting the muscles and bones. With this connection, it aids in the movement and structure of your horse. With the movement and structure, if the tendon is attached correctly, there will be enough give to allow the horse to fully stretch their leg to its full capacity and achieve a desirable stride, which will help keep the footfall pattern correct and the body to not go out of place and cause even more pain to your horse. If the tendon is not attached correctly, the stride can become shorter, which means the tendon is tighter than it should be. So as time goes on, the tendon will wear through and tear. But the stride can also be too long, which can cause the foot to hit the ground incorrectly and cause further damage as well. So some ways that the tendon can become damaged are from the calcaneus bone, which is what the tendon runs over on the back of the leg. If the bone happens to be sharper than normal, then it will cause the tendon to wear through and quick and tear. If the bone is more round, with the usage, the tendon will slowly slip off the bone and become loose and disconnected. With heredity, if the parents are known to have Achilles tendon injuries, the children are more apt to as well. Lastly, with the lack of exercise, the tendon is unable to build strength it needs in order to keep from wearing down or getting sore. It's kind of like when you're training your muscles. So, if you don't want an injury to occur, be sure to provide adequate exercise for your horse. Some techniques for early diagnosis are to be sure to know your horse's legs. Either after a workout or on a daily basis, feel them and see how they feel when they are structurally sound. This later will help you notice when something is out of the ordinary. Also, you can have a grayscale test done. This helps look at the tissue level and to see what is wearing and where it is occurring. If an injury gets too extreme, you can resort to a surgery. But this will take time in the end to try to build up the tendons back to their normal strength. And in the end, your athlete may not be able to perform again. So it helps to start with prevention. For instance, heredity. If you plan to breed for an athlete, check the genes first. Check to see if there is injuries in the tendons of the parents. If they have, see this as a red flag. Exercise. Remember this. This is key, especially with young and growing horses. Don't keep your horses in a stall all day. Allow them to run in the pasture. for at least 12 hours a day. And lastly, know your horse and check their legs often. And as a lasting thought, horses are the ones that are in need of gradual work to build the strength they need in their legs, to keep the pain from occurring in their feet and legs. Remember this, and you both can succeed painlessly. And here's my works cited. Feel free to review at your own pleasure. And thank you for taking the time and listening to this presentation. I hope you learned a lot from this and can help you and your athlete succeed.